just clearing around the trachea and around the larynx. Okay? So you can kind of feel with your scalpel right here, that is the thyroid cartilage right there. And then there's a little soft area, and then this is the cricoid cartilage right here. Okay. Now, we're going to do a mid-sagittal cut through that to see if we can see the vocal folds. Now, you won't be able to identify really the true and the false, just vocal cords or vocal folds. So if I do a mid-sagittal cut through that area, and just kind of pull it apart. Okay. Let's see how we're going to do this. You see that flap of tissue there? The lighter colored tissue there? Mm-hmm. Those are the vocal cords. And so right there.
I can see that.
Okay?
Yeah.
Okay, good. All right. So that channels the larynx, thyroid cartilage, cricoid cartilage, vocal cords. Okay. This is the trachea. So if I said name this channel, you'd say trachea. And on here, the tracheal cartilage is darker in color, and then the connective tissue in between is lighter. So if I stuck it in here and said name this structure, tracheal cartilage. Okay. Now, to see the trachea branch into the primary bronchi, we've got to get rid of some of these big blood vessels. And the heart. But when you're cutting out the heart, make sure that so there I just cut the inferior vena cava. Make sure that you're not cutting the trachea or bronchi when you cut that out. And you can cut open the heart if you want, and look. Yeah, look at the different chambers of the heart. So just cut that aortic arch.
It's a lot less cluttered now.
Yeah. All right, so there's, what would that be? There's the superior vena cava. I can't even think of what that blood vessel would be. Right there. I'm going to cut that out. Okay, so this is all trachea coming down. If we identify the lobes of the lung, this would be right superior lobe, right middle lobe, right inferior lobe. Okay. Left superior lobe. See, we don't have the left middle lobe. Cat does. Left inferior lobe. Okay. And then they've got another little extra lobe here too. Okay. So on the right, right superior, right middle, right inferior. On the left, left superior, left inferior. Okay. Now let's see if we can see that trachea branching into the primary bronchi. And it's really easy to end up cutting through those channels there. So I would kind of shy away from using the scalpel in this area. So this would be the right primary bronchus, left primary bronchus. Okay. Okay, that's it for that. What else on your list? The diaphragm. Okay, so remember this is the diaphragm right here. Oh, visceral pleura and parietal pleura. So I would go just, on the inside wall of the thoracic cavity, take a layer there, and that would be parietal pleura. Try not to get any muscle in there. And then directly on the surface of the lungs would be visceral pleura. That thin layer. And I think that's it. Sweet.
The pleural cavity, is that the whole
Oh,
thing?
yeah, it's just the
Okay.
thoracic cavity. Yep. Yeah, I just drop a pin in there for pleural cavity.